Hello, this is Christopher Ian Earle. I am a DNP graduate student at Arizona State University. This is my doctoral project titled Perceived Barriers to the Implementation of Psychoeducation and Evidence-Based Practice on Inpatient Psychiatric Units. This presentation should take approximately 10 minutes regarding the importance of psychoeducation to our patients, the importance of psychoeducation to nurses, using evidence-based practice as the driver of new knowledge behind what we teach, and recognizing barriers to providing psychoeducation on inpatient units. You can either listen to this narration through the slideshow format, print the notes to the slides, or peruse the slides at your own pace. Thank you for participating in this educational module. Psychoeducation uses evidence-based practice, or EBP, to provide basic information about mental illness and treatments. As we know, patients often do not have a basic understanding of mental illness when first entering the mental health system. Whether it is a parent bringing their adolescent to a hospital, a 21-year-old having their first psychotic break, a veteran suffering from combat PTSD, or a new divorcee suffering from overwhelming stress, each patient finds themselves battling mental health issues and need a new understanding regarding their situation. Psychoeducation provides this basic information regarding mental illness and available treatments. Psychoeducation usually includes learning about their diagnosis, the biology behind it, how stress affects it, and practical effects on mental illness. It includes learning about medications and why they work, and what symptoms can be managed through effective meds. It involves learning about social supports and how to strengthen them, whether this is friends, family, coworkers, religion, or other outside influences. It involves coping skills and how to prevent a mental crisis, how to cope with stress, and how to cope with persistent problems or symptoms. And lastly, it involves learning how to live with mental illness, which includes recovery strategies, avoiding drug and alcohol use, reducing relapses, and getting your needs met in the mental health system. Looking at psychoeducation in the hospital, psychoeducation plays an integral part in allowing the transition from a mental health crisis to mental health recovery, where a safe environment and effective medications help alleviate some of the anguish from a crisis when a patient first admits to the hospital. Psychoeducation and therapy help the patient gain a better understanding of their situation, what factors produced it, and how to recover from it. Moving more towards recovery and ongoing treatment, partial and intensive outpatient therapy usually have a large psychoeducation component to them, as the patient continues to learn to live with mental illness and appropriately manage their symptoms, while building coping skills and supports to overcome obstacles in their lives. So again, the purpose of psychoeducation is to gain a better understanding of our mental illness, build our supports, learn new coping skills, and learn to manage the demands of life. So if one or two supports happen to weaken or fall apart, our patients still have the cognitive and emotional abilities to overcome these obstacles and maintain mental health, with a few supports that need to be strengthened again. Looking at the EBP model, the big question becomes, does the evidence and research prove that psychoeducation does help patients? Looking at only the bipolar patient population in this slide, psychoeducation does make a difference. In 3 large studies from Cullum in 2009 using both inpatient and outpatient participants, Bauer in 2006 studying a collaborative care model over 3 years, and Bowden in 2011 performing a meta-analysis of many bipolar studies, psychoeducation in the bipolar population showed increases in time to relapse, decreased length of a manic episode, decreased hospitalizations over time, increased overall function, and decreased manic symptoms. So psychoeducation is important. In a national guideline provided by the Agency for Healthcare Research and Quality, titled Clinical Practice Guidelines for Psychosocial Interventions in Severe Mental Health, psychoeducation was recommended to be integrated as an additional intervention in an individualized treatment for SMI patients, including patients with depression, anxiety disorders, thought disorders, and bipolar disorders. Also, family psychoeducation should be given to family members with schizophrenia, and that psychoeducation to the bipolar population should also include understanding early warning signs and be used as an adjunct to pharmacological treatment. Psychoeducation is important for the patient. Understanding the importance of psychoeducation as EBP is important to the nurse who is performing this task. Understanding that participation in providing psychoeducation and building our knowledge and what we teach is just as important to us as nurses. It has been shown that nurses who participate in EBP prevent nursing burnout, are more satisfied with their jobs, feel more empowered, have stronger group cohesiveness on their units and in between different disciplines, increases the quality of care given to their patients, increases healthcare outcomes of their patients, while continually updating their practice and knowledge. The EBP model is the engine behind providing psychoeducation. The EBP process states that we ask the clinical question, search for the best results through research of conducted studies, appraise the studies found, of which are valid and reliable to answer the question and integrate the evidence. In this case, we may either integrate the new knowledge into the psychoeducation program we are teaching, or make recommendations to others on the healthcare team regarding changes in hospital practice. According to the new Freedom Commission on Mental Health regarding why EBP must be implemented, the chairman Michael Hogan states, if effective treatments were more efficiently delivered through our mental health services systems, millions of Americans would be more successful in school, at work, and in their communities. Doesn't it sound like we just need to start asking the questions? And that is the first step to having an active, vibrant psychoeducation program that begins to deliver higher quality healthcare and better patient outcomes. To ask the questions while creating a spirit of inquiry. What is our current psychiatric knowledge, and are we keeping abreast of the research? What drugs are people abusing nowadays? What does the detox and recovery look like? And what is happening in their bodies? Has our knowledge from 5 years ago, 10 years ago, 20 or 30 plus years ago when we were in college, has our knowledge kept up? What are the latest medications, antidepressants, antipsychotics? What's coming out soon, or what is being used in other countries? What new mental health issues are emerging in the veteran population alone? Combat PTSD, military sexual trauma, traumatic brain injuries, and completed suicides prior to deployment are all new mental health issues affecting the armed forces. What treatments are available to this population? These are all great questions with relevant answers that have to be studied. Do we know the answers to these questions? What are the barriers that prevent us from getting these answers so we can provide more knowledgeable care to increase healthcare outcomes to our patients? The four main barriers to building an EBP culture are first, lack of EBP knowledge of the nurse, which includes lack of researching skills, resistance to change, negative attitude, or lack of autonomy. Second barrier, lack of support from administration, including set-aside time for research, lack of mentors, and lack of teamwork skills. Third barrier, lack of research culture, where EBP is valued and integrated. Computers and library databases are available to the researchers. And fourth, lack of time, both from the patient workload or administrative support. Understanding these four barriers to EBP process can help us overcome these obstacles in building a sound psychoeducation program. By tackling these barriers up front, the success of running a psychoeducation program based on EBP increases dramatically. Administratively, we must seek support to foster a culture of EBP. Shareholders must know that this will create a more cohesive and knowledgeable workforce, which also increases patient outcomes and may feed into other outpatient programs, thereby increasing revenues. The barrier of time must be confronted to allow nurses to participate in this endeavor that benefits patients, nurses, and the hospital as a whole. The barrier of lack of mentors must be confronted, where a psychoeducation team and program is being advanced, and master and doctoral level workers are recruited to mentor the EBP process. The barrier of persistence and lack of nursing knowledge must be challenged to always keep asking clinical questions that are relevant for our patients and our practice as nurses. By identifying and addressing barriers up front, these obstacles can be overcome. The EBP process is an integral part of psychoeducation to both patients and nurses alike. As nurses, we must cultivate that spirit of inquiry while challenging our hospitals and our units to be proactive and value the culture of EBP. Through our perseverance, not only do we become better as nurses, but we know we are providing the best treatment, therefore the best chance for healthy outcomes to our patients. Again, what barriers are in your way from implementing an EBP-based psychoeducation program in your hospital? Here is the reference page to this presentation. Please be sure to fill out the last barriers questionnaire before closing out this learning module. Again, thank you so much for your participation.